lower picture you
Sir,
can check.
we are still on the first slide.
You,
Would
and what's happening like this.
now, yes.
And why we have somebody, when my students present me the presentation, you have these problems too with the changing of slides. I think it's depend by the some changes in a Zoom. I think so. They give us the new update, yeah, and that's why we have this problem. That's why I list the slides like this without any full screen version. I'm sorry, and I don't know why it's happened.
Yes, sir, many teachers are having the same problem.
Okay, thank you so much. If you agree with me. If we try to classify the wounds, we must firstly based on the region. It's operative and accident. Our operation wound, it's our approach when we made some open reduction on some other operations in the traumatologies and all approaches which happened in any operation rooms in the world. If we try to understand the cause of these wounds, we understand that intra-operations wounds, it's a successfully clean wounds in the world. Yeah, all things which happened are accidental. All of these wounds contaminated by different kinds of bacteria, and these contaminations depend by the cause of this wound. If we try to classify next the accidental wounds, we speak about the first kind, it's a mechanical. We can classify them depending by the depending on the cause of it's a braided wound, punctured wound, incisors, cut, crush, torn, bite, and short. And all of these depend by maybe by the traumatic body. If we try to classify the chemical wounds, we must understand that these burns can be caused by acids and by base. And if you want to help this patient here in a place of accident, if you have a chemical acid wound, you must use the base for neutralized and for check the salt and the water. If you have a base, you must use the exit. It's like a special antidote for these kinds of the wounds. Wounds caused by radiation, all of you they check the HBO serial, it's a Chernobyl, and you can check how the radiation wounds showing there. And wounds caused by thermal forces, it's a burning, freezing, or frostbites. Don't forget that if we have a high temperature causes, and after that we have a low, we have a frostbites, and maybe in your countries it's not so actuality. Here in Russia, our winter is start. That's why after a few weeks we check too much of frostbites, and usually who get these kinds of injuries, we understand that usually it's unsocial persons who rest or spend too much time outside from her apartments. And special kinds. According to the bacterial contamination, we can speak about the clean wound, but it's a fairy tales, no any wounds, no any non-contaminated wound happened in the world. We understand that we try to guarantee aseptics and antiseptics conditions were into our operation rooms, but after operations we use the antibiotics too for prevent any purulent problems. Clean contaminated wound, contaminated and heavy. Heavily, it's if it's wounds dirtied by earth, by some other problems, some other things, and all of this usually which you check, and me too, and which wounds we treat, contaminated and heavily contaminated. Depending on the depth of injury, we can understand and we can check that we can see the superficial, partial thickness, full thickness, and deep. All of these things treated in a different layers of the medical health system. Superficial and partial thickness, usually it's a ambulatory kind of the treatment and of the wounds, and usually we don't made any operation steps for clean and treat these wounds. And full thickness and deep wounds, here we made some operation steps. Most useful classification from the partial point, it's a rank of quick and field. It's two authors which describe us the classification of the wounds, and we use this classification anywhere in the world. Depending by this classification, we try to classify the wounds like 2D and i2D. 2D wounds, it's a clean wounds caused by cutness, knives, choppers, and other things. And maybe one of these wounds, it's present in the emergency room, discharged with instruction and follow-up. Sometimes I read something from my slides. Why? Because nowadays the maybe knowledge of wound is not just generally traumatology problems. Nowadays, if we have a wound which penetrate any organs, it's a surgical department. And here in trauma, we treat just the wounds which localized on extremities, or maybe each wound which not penetrate any organs. For example, you check here some wound after some choppers maybe and some others. If you want to understand how this wound contaminated by bacteria, first of all, where this picture made. You see the phone, it's a street. That's why if it's a fresh wound, it's a full contaminated wound, not so deep. And how to treat it, I told you about a few slides. Anti-UD wounds, it's a sum after crushed, avulsion, barded, and mulgent parts. It's a general and large anti-UD wounds require operative debridement and the hospital admission. If the wound from previously slide, we can stitch, we can clean them and put the stitches and treat the patient conservatively. These wounds must present in a department. You check this picture. The picture is not so cool and not so well quality. Why? Because I forgot it's some member of our department made this wound. What's happened? So interesting situation about this patient. It's a combination from the frostbite and wound, and this patient treat this wound few weeks with urine. He inserted this herpel into the bottle with urine, and like this try to decide that he kill all bacteria which contaminate her wound. Now you check what's happening. We have the big area of deep necrosis, which present in a second area of the palm and in the fingers too. Tudy and anti-Tudy wounds. Tudy wounds, it's generally caused by sharp weapons, and Tudy generally caused by blunt and crushing weapons. Tudy wounds, non-skin loss, characteristic of them, and anti-Tudy wounds, it's a varying degrees of skin and loss common. Another definitions of these wounds you can check on this slide. Please, I can't commentary this because I don't understand. More actuality for us if we check the acute and chronic wounds. We understand that trauma is an emergency department. That's why here we usually treat the acute wounds. But the chronic wounds usually it's happen dependent by some problems in them. Depend by sugar diabetes. It's a distal third of the lower extremities. Usually we name these wounds like ulcers, it's a hypertrophy ulcers, neuropathic ulcers, and others. And if you speak about the acute kinds of the wounds, we can classify them depending by the how it's wound seen deep. That's why we can check your lively bruise, contusion, and hematoma. All of this, it's a superficial kind of the wounds. Puncture wounds, abrasion and friction wounds, laceration, traction, and avulsion crush. That's why all of these things depend on the deep of these wounds. Bruise and hematoma. All of you start to describe as the general symptoms of the fracture from the bruise, hematoma, and something else. And I told all of my groups that bruise, it's just a single special kind of the soft tissue injury. It's not does it mean that our patient have a bruise. You see, First of all, it's a superficial kinds of injury. Second, what does, if we check this morphologist, what is it? It's a subcutaneous hematoma. The size of these bruises can be different. We can see the tension or untension kinds of them. But if we speak about the bruise, we have not any big cavity under the skin. It's not a localized hematoma. If we have this cavity, we must name it like a hematoma. You see so beautiful faces with the bruise. I think that not all of you have these kinds of these things, or if you spend some time in the Kursk clubs, yeah, you understand that it's so violent places, and if you unlike somebody or somebody unlike you, you can check these kinds of hematoma. On the right picture, I think that it's a young Steve Jobs and her first model of Macintosh, which non-work, and he sent somebody this gadget for with a so high price. But after that, you understand that all of this situation happened normally. Puncturing wounds, and it's more deeper than bruise and the hematoma. This wound have a so small and usually deep wound canal, and sometimes we have a locally purulent problems here around this wound canal. These things happen at, I don't know, too much time when you insert something into your pelvis, when you maybe suturing something, and the treatment of this wound have not any problems if it's not so contaminated by any dangerous kinds of bacteria. And nowadays, the number of these wounds decrease. Why? Because if 2 years ago we wash our arms twice per day, today the new era of us, I told you about the SARS-CoV-2 infection, uh, told us that we must clean our arms. I don't know how much time when we don't see the ligaments or flexion ligaments in our palm. That's why the number of these punctured wounds decrease. Then sometimes we can check the local symptoms of local inflammatory. We can see the redness, swelling, pus, and watery discharge, but usually there's low doses of antibiotics or maybe locally using of any solutions of antiseptics reduced all of this locally inflammatory see. Abrasion and fraction burns or wounds. It's a scraped of by the contact with the surface such as roads, carpets, and other hard floor surfaces. I told some of my groups why the Spider-Man don't choose yes, today I speak with my group, the Kursk reached, or generally the Kursk's the Kursk city, because if he wanna fly near the buildings, here we have not any high buildings, and I think that Spider-Man have too much of abrasion wounds on her frontal surface of the chest. He have abrasion in the knee joints and some others. That's why we have not any superhero in our city. You check the picture of abrasion wounds, maybe it's the legs of our Spider-Man, who's choose the Kursk, and what's happened with her internal surface of the ankle joint with the abrasion or friction kinds of the wounds. These wounds are not so deep, but so big injured area guaranteed that some inflammatory changes you can see after a few days. That's why you must make the first debridement of this wound totally and use the aseptic bandages for prevent your patient from any purulent genital problems. And don't forget that after a few days, the regeneration into this wound happening. That's why let's use the special, more innovative kinds of the bandages, which based on some gels, on some others for non-broke, this young and so soft new generation, new granulation tissue into this wound. Laceration. It's a kind of result contact with a sharp object. It's your lovely Game of Thrones, because nowadays if the patient have some problems, they use the gun shoot, and into the civil they use the knights, and that's why we have too much of not so deep laceration wounds. Or maybe you clean a potato on your kitchen and have these laceration wounds in your fingers. If you're not so lucky, somebody of you maybe can lose the distal phalanx of your fingers, or maybe you're potato lovers, that's why you have these problems. Another situation is it's more deeper than abrasion kinds of the tissue of the wounds, and sometimes we can check the disturb in the tendons, muscles, or bones. If you're a potato lover, maybe we speak like this. Sorry, and I check that. Traction and avulsion. It's more deeper kinds of the we going down or internally to any tissues, and we speak about the traction and avulsion. It's a more. I have this. Yeah, you must understand what is it. We have a traction of the tissue, or firstly at the skin, but all muscles, tendons, and others which present under the skin stay normally. And you check like the patient forgot to dress something on her pelvis in the morning. It's maybe your arms after some Friday hot party when you forgot to dress your skin. It's a difficult to treat kinds of the wound. Why? Because after a few days we check a total necrosis of the skin, and the treatment of these wounds it's so difficult. Why? Because we have a super infection, and this super infection we must treat it firstly from the secondary skin. Skin plastic, maybe it's a free or unfree kinds of them, but this infection which starts after a few days guaranteed that we have some problems. And some days, maybe in the last year, we have some tragedy in a small village near Denkurs, the beer, yeah, take some special person. It's a small amateur, maybe zoo, and I don't know how the beer lives there. And this beer broke some women arm, and she have a avulsion of all skin from the upper part of the shoulder to the distal phalanx of her pelvis. But the result of this treatment, well, why? Because all of this traction and avulsion injuries guarantee that all subskin tissues stay alive. That's why if you win in a bacterial contamination with the antibiotics and many special kinds of the bandages, you have a well results in the treatment. Crush injury. Of course, when the body parts is subjected to a high degree of force of pressure. Maybe it's some special kind of the wounds which according with the high pressure on this extremity. It's a some part from our lecture about the crush syndrome, my previous lecture for you, and how my friend, and how it seems we have a more deeper kinds of wounds, which according with the fracture of any kinds. If something weighty fell in on a patient's foot, for example, here, we have a combined kinds of injury. It's a deep wound with the multifragmental fractures of the metatarsus bones. Here in this situation we have some problems because we can't operate the open fractures immediately here, but we try to stabilize this fracture by externally plaster cast. And this cast sometimes guarantee that we have anaerobic infection under this cast, and if we have a primary staphylococcus dependent infections after this anaerobic stain, we can see the anaerobic kind of infection here too. And finally, it's a great problem. Maybe finish it by amputation of this extremity. That's why when you treat these combined kinds of the wounds, let's guarantee the well aeration for these wounds. I need maybe somebody present in my like this now. Okay. And if we have a crush kind of injuries, we have a shaking of all tissues around the wounds area. And after a few days, we see the necrosis of them. It's chemical or maybe colliquation or maybe without water, underwater, without water kinds of the necrosis. That's why this combines kinds of injuries guaranteed that we have local problems like wound, and we have symptoms of general intoxication of our patient by the poisons which product around this wound. And we treat locally the wound and treat the patient generally. We must trust the intoxication therapy, infusion, or maybe some absorption for protect our patient for any polyorgans dysfunction. It's our compartment syndrome. I told you about this. Chronic wounds. It's a classically diabetic food. We have not any exudation from this wound, and these things characterize the chronic kinds of the wounds. You check where these wounds usually localized. This is the most pressured part of the foot. It's a calcaneus area and first metatarsus, first finger joint. Why? Because the patient have a distal podoneuropathy, and they sometimes not understand that they use the uncomfortable shoes, that they have a locally compression, and they are non-check. They have not any pain syndrome and something else. Just on, I don't know, on examination, the doctors find these chronic kinds of. It's ischemical ulcers. I told you like this. It's so difficult to treat kinds of the wounds. Why? Because the speed of regeneration in a distal angioneuropathic conditions, it's so low. That's why you can't find the well granulation of these chronic wounds, and sometimes for treated we must, and we have a here we have a lymphostasis, and that's why we see that this food seen like a, I don't know, like a bread. Yeah, so taste white bread for the new, and you can insert it into the toaster and make the morning toasts. Are you hear me? Somebody joke?
Yes, doctor.
Somebody smile after this. You want to taste it?
No, thanks.
No, yeah, me too. And these things I told you smells like legs of deadly grandpa. Let's taste this smell. Wound management, the care. I told you that it's a special kinds of science if you want to treat the different kinds of the wounds. Why? Because here we have some basic things, and I told you about this, but the well results of the wound treatment depend, I don't know, from your internal feeling, which kind of bandages you must use tomorrow. Because all of the wound process, it's a changing from two stages. It's a granulation and exudation stages. And next day, it's not the same like previous. And when you use maybe activate all of some of these processes, you can make the you can make the well results. Don't forget that first of all, when you check the primary, and you, the person who check this primary wound, let's clean this wound successfully. If you have some special antiseptic solutions, why not? But non-use the spiritus. Why? Because the spiritus guaranteed that you have some coagulation of the proteins into the wound canal. That's why the regeneration non-happened finally. That's why you use non-so aggressively peroxides or maybe some special solutions of any modern antiseptics. Let's take alcohol removes small, yeah. And if it's not so fresh tissue, not so fresh wound, please don't touch the fresh and young granulation tissue. It's a possibility for cover this wound. If you take off all of these tissues, you have not so cool results. Antibiotics. I told all of you that I don't prove when you use the antibiotics locally. Don't forget that antibiotics, your solution into the syringe when you inject it without any dependent intravenous, intramuscles, and some others, it's a non-active form of them. Just after some metabolism into the heparin, we can find the active forms of them. That's why if you use this by injection, you have a therapeutic concentration of this antibiotic after a few times in the blood. If you use these antibiotics locally, like a pulvis, and you insert it into the wound, you don't find the well treatment concentration into the wound. That's why local use of antibiotics, it's a fairy tale. It's my general opinion. If you check the character of this wound, and this wound not so deep, this wound have not any purulent problems and others, you can use the suture, staplers, tapes, or other things for covering the size of this wound. But if it's so dirty wound, if it's secondary contaminated, please non-close this wound by the stitches, by the suture. Use the active or passive drainaging for reduce the future purulent problems. Dressing, you must use the well bandages from the sterile materials. Don't use your dress or syringes for cure this wound. Maybe if you want to save the patient's life in this situation here. And others, please use the well dressing. Change the dressing regularly if this wound have some exudates and you forgot about your patient for 2 or 3 days. What's happening? All of this exudation starts to present into this wound. And that's why this wound non-clean totally, and you have some another purulent problem. Don't forget that you must make some special bacteriologist analysis. When you have a primary, maybe in your opinion, clean wound, let's insert some tube into this wound and take some milliliters of the wound exudating and send this analysis to the bacteriologist laboratory. And they give you what? First of all, they give you, how I told you, they give you what? Like Russians, yeah? How you want to stay alive in New York City, in a so criminal part of them. Let's tell this band, yeah, that you're Russian. Let's start to speak like this. I'm a Russian man, and I was born in Kursk City. Without depending where you're born, these criminal bands have not any questions to you secondary. Don't forget, Russian dialect save your life. And Russian diploma too. That's why, and the laboratory give you what? Give you the, first of all, the bacterial agent, they give you the name of bacteria, and secondary give you the list of antibiotics which have, or maybe a list of resistance of antibiotics, and you use the antibiotics targetedly for this special kind of bacteria. The wound healing. It's a first stage, it's a hemostasis inflammation. It's happened after usually 2 or 3 days after injury. Granulation proliferation, I told you like this stage can happen near then after 2 or 3 days after first period, and near then 6 months, I treat one patient like this. And remodeling or maybe reconvalescence. It's a finally stage in a wound healing. Here on a, I started to speak too much every day. I don't describe you these things, you can read about it anywhere, but if you speak about it, okay. If you speak about the stages, hemostasis, inflammatory, here here on this slide, we describe the physiologist of this scene, but I told you like a doctor that in this situation you must use the temporary general methods for stop the bleeding, for your patient not lose too much of blood. Granulation proliferation, you can check that which cells play a great role into this stage, but in this situation your role like a doctor, you must meet them everyday changing of bandage, you must clean this wound, you must change the antibiotics, and remodeling, it's your winner time. When you close this wound without any purulent problems in this situation, all of things happen well. Here we have too much of cells. For me, every time it's some metaphysic things, because we show you some red, white, and other spots and named it like a cells. But here we have a description of the wound healing by the special kinds of the cells. In a hospital, you don't check all of these cells. You check just everyday picture of this wound, but you must know about it too. Types of wound healing, the better if you have this situation, if you have under the wound canal, you have a new angiogenesis. These things guarantee that your new granulation tissue, which starts to grow into the wound canal, do it fast. And you have the last remodeling stage, you checked it early. It's a definition by the pictures. It's a first wounding stage, or maybe first stage in the wound process. It's a bleeding. Somebody cooked the potato, and broke her second finger, and we have a small scarred wound on the surface of the finger. You check that it's a wounding. It's a second next stage. It's inflammatory. It's a cleaning the wound by the macrophages and other cells which starts to present there and try to stop this inflammatory. It's a bad source. It's a bad source. Why I insert this picture into this wound lecture, I forgot, but you can see that something happened not so well here, because we must check here the second stage. It's a active granulation of the wound, but here we have according some purulent problems, and you check what's happened with the wound layers. We have a pierce here, and we have not any granulation, and we have not any final stage of the treatment. Let's turn to our finger. It's a inflammatory and cleaning wounds continued. It's happened usually after 3 or 5 days, depending by the size of this wound. If we have according inflammatory here, or maybe purulent, we have these kinds of the problems. But what's happened in the left picture and what's happened in the right picture? We use the debridement, we change the bandages, we use the general antibiotics, and we check finally what? We have a totally clean wound without any purulent problems. And our next steps was try to check here the new granulation tissue. But the size of this wound is so big, that's why sometimes we need the skin replaced. Inflammatory phase, it's if the infection starts to process into this wound, you check what can happen. So big erosion, it's not a classical wound, it's erosion, and this rose tissue, it's a new regeneration tissue, but the number of this thing is not so high. And you see that some purulent problem starts here. I forgot what's happened secondary with this patient, but I think that we made some skin replacement. Inflammatory phase, when we made the debridement of this wound, for starts to check the well regeneration. Maybe for you, you tell us that what is the blood we found out, what is the meat factory. But we clean this wound. We check that all of the surfaces are bleeded. That's why we understand that we have some vessels which present under this wounded surfaces, and the regeneration happened no better. But we try to cover this wound by the skin plastic for protect him from the new inflammatory problems. And let's turn to our lovely finger. How much days happened after first injury? 3 to 24 days. Why? We are not the mutants. We can't regenerate faster. And when you cook your lovely potatoes, you understand that if you have this current wound, after 1 week or usually 2 weeks, that's why how much in 15 days, you have a total reconvalescence of the wound. And proliferation stage, it's a growing of the new tissue. This is the most interesting thing. Why? Because sometimes the wound process here can show you the hypergranulation. And you don't need too much of this new soft tissue. You try to cut them. All of these surfaces are bleeded, and you don't understand what's made else. Let's make the skin plastic. Let's cover this wound surface by the new skin, and like this you reduce this hyperproliferation. Proliferation phase, you check what's happened with our previously skin replastic. All of this skin rested present without any necrosis. That's why we can see the totally covering of the wound surfaces. And maturation stage, we use sometimes we can check the scare on a place of the previously presenting of the wounds. And sometimes we can see the pathology kinds of the scares, we named like keloid scares. Sorry. You understand all of my words?
Yes, sir. Yes.
Thank you so much. It's a good definition. This is a hypergranulation things. You check what's happened. It's a new papilla happening where in the frontal surface of the abdominal, and sometimes we can check the penetration of any organs. And maturation phase, we can see the scars. The scars here, it's so rose and so elastic. And here in this stage, the most important for us for checking for stay the scars in elastic phase. Because if we have so soft condition of them, we can see the limited to function in this joint. Factors affecting it's not so interesting. ABC. And after that, I have here. I want to start speak about this. It's a local treatment. It's a first aid in a place of accident. Firstly, you must stop the bleeding. You must analgesic your patient wells. You must use the aseptic bandages, immobilized by our rules to opening joints, and transfer to the hospital, like this. Why we don't clean this wound here? Because maybe the general condition of your patient is not so stable. That's why the doctors in admitted department clean this wound successfully. We don't speak that we have some subaerial ulcer into this wound and maybe so contaminated bacteria. That's why we understand that the presenting of these bacteria for a few hours in this wound is not so dangerously for our patient. And in the hospital, we made a local anesthesia or maybe a local regional block by some volume of the local anesthetics, and made the debridement of these wounds. How much time? How much of preparation, antibiotics? I think that I've finished. Yeah, all of these things we speak about in the polytrauma here. That's why I finished my lecture about the wound management. And if you have not, somebody have any questions for me? 14 minutes. I don't take any of your minutes more than I told you before.
No questions, doctor.
That's why have a nice evening. I think that you repeat something from the general surgical department because your entrance to the wound treatment happened there, and here in the trauma department we just repeat it for you because it's who treat the wound nowadays, usually general surgeons. Okay. That's why have a nice evening. My group, you're welcome tomorrow.
Yes, sir.
Thank you.
Doctor, bye-bye.
Thank you, so